Welcome to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. The bad news is that our healthcare is once again under attack by Republican leaders in Congress and Donald Trump. The good news is we are all standing up and fighting back. We're doing a healthcare takeover on the show this week, brought to you by Moms Rising, along with Protect Our Care, Justice and Aging, Active Peace, and more. So welcome to the show. I'm so glad you're joining us for the healthcare takeover, you all. It is a healthcare takeover this week. And with us, we have Adam Hoyer of Protect Our Care. Yes, please, Protect Our Care. Welcome, Adam.
Hi, thanks, Kristen. It's wonderful to be with you again.
I'm so glad you're here, even if this is kind of a downer of a show. Healthcare is under attack right now in so many different ways, and it's not making the news in the way that it should. We're getting kind of pieces of information about healthcare being under attack from various different programs. I'm wondering if you can share with our listeners, with our viewers, with our audience, what in the world is happening with healthcare being under attack right now? How is it under attack?
Yeah, it's hard to believe that we're here again. And anytime I get asked to go anywhere, it's always kind of under this dark cloud because it means there's bad news coming. So there's kind of three ways that healthcare is under threat. And I will say that it is kind of ambiguous by design, right? Like not to go too far into the weeds, but insurance companies, drug companies, and their allies and Republicans in Congress and in this administration, it's complicated by design. They are hoping that the people that they are ripping healthcare away won't notice, and even more than that, won't know who to blame. But I want to take a step back because there's a few things, as I mentioned, that are under threat right now. First of all, last year, the big ugly bill that passed made $8 trillion in cuts to Medicaid and the ACA. And a lot of that won't even be felt until next year, conveniently after the midterm elections, also by design. Nonetheless, the CBO has estimated that in total, all these cuts are going to lead to 10 million more uninsured people, including 7.5 million people thrown off of Medicaid coverage. And despite this fictional narrative that Republicans cooked up all throughout the passage and after, that somehow these Medicaid recipients are unemployed, they're playing video games in their mom's basement or whatever, all fiction. The vast majority of people who gain coverage through Medicaid expansion, which is where Republicans really made the brunt of these cuts, the vast majority of those people work. They fit the work requirements that Republicans kept standing up and saying we need to implement work requirements. They're better called paperwork requirements because all it does is add another layer of bureaucratic tape in order to throw people off of the Medicaid insurance. So it's not about work requirements. It's not about waste or fraud or abuse. It's about using bureaucratic red tape to rip healthcare away from people who need it and who deserve it. Also, they could give more tax breaks to the billionaire buddies. It is sickening. And on top of that, in effect, we're already seeing, not even though most of these cuts don't go into effect until next year, hospitals and care facilities that depend on Medicaid funding to stay open, mostly in rural areas where access to care is really, really sparse. Already, we have seen that more than 800 hospitals and care facilities have closed or have come under serious threat of closing in the near future. And not for nothing. Now that Trump and Republicans are mulling another reconciliation package this spring, looking for ways to fund this asinine conflict in Iran, where are they again looking to make cuts to pay for it? Healthcare. Again, they're hoping that people won't notice or they won't know who to blame when their premiums skyrocket, when they lose their coverage, when they suddenly need treatment and can't afford it or can't find the hospital that used to be open or have to choose between making healthcare bills and paying rent. It's not right. Especially at a time when this administration and Republicans, they've made everything insanely more expensive with tariffs and wars and bewildering policies. And so our resistance to this, Kristen, as you know better than anybody, our resistance to these cuts has to include putting a face on who it's affecting. We can't let this narrative stand that it's lazy people who don't deserve coverage somehow. It's everybody. Every one of us knows someone or is someone who depends on Medicaid or the ACA. And the cuts that they made the ACA also are nonsensical. You think about the ACA, a program that passed in 2010, took effect in 2014. Ever since then, you could see the uninsured rate ticking down to where by the time Joe Biden left office, it was the lowest it had ever been. The ACA was the most popular it had ever been. People were the most satisfied with their healthcare in our nation's history. And what did this administration do and Republicans in Congress do? They took away the subsidies that were making insurance more affordable just because they got a vendetta out against Obamacare and they needed money to pay for the tax cuts to the billionaires. So what we're seeing, the uninsured rate going right back up, insurance costs skyrocketing, and people can't afford it at a time, as I said, when inflation is making everything else so much more expensive. It's not right. And we're heading towards a perfect storm of a disaster next year when those Medicaid cuts take effect.
Our taxpayer dollars are intended for healthcare and are being realigned to go into things like military spending, to go into things like private yacht tax breaks, to go into things like human rights abuses in the name of immigration enforcement and cruelty. We don't want that. Taxpayers don't want that. Polls show that Democrats, Republicans, independents, libertarians, everybody wants access to health care. And yet the Republican leaders and Donald Trump continue to make cut after cut. What can people do? I know they're listening right now and they're like, whoa, it's actually worse than I thought. What can people do? Because solutions are possible. And I want listeners and viewers to know this. Solutions are possible. It's going to take persistence, but it's possible. So what's your take on solutions?
I have three solutions, and they're not going to be satisfying. But I promise you've been in this space a long time. I've been in this space a long time. I'm old enough to remember the ACA repeal fight that we beat in 2017. It takes three things. One, speak up. Even if you live in a blue district in a blue state, tell your member of Congress we cannot stand any more cuts to healthcare. Thing two, share your story. Even if you don't rely on Medicaid or the ACA or the subsidies that made it affordable for so long, I'll bet you know someone who did, or, just stand up for the principle of it. Because as I said, this administration has done one thing really well since it took office, and that is distract. Every week it's a new distraction, something that doesn't matter, some new fight that doesn't impact anybody, that doesn't make any sense. All the while, people that are actually affected by these policies, those go largely unnoticed. So we need people to pay attention, to raise their voice, to speak up, to take part. So look, social media has never been more impactful than ever right now. So kudos to you. The tweet storms on X, on Blue Sky, your own social media channels, those are your members of Congress. Speak up, share stories. The third thing, and this is, a little more vague, but taking to the streets. No Kings protests are wonderful. They're shows of force that get people attention, but even smaller events in your community, they make a difference. Local news is still the most credible place for news. I know with all in this world where we can get news from everywhere, right? It's on our phone, it's on our social media, it's on YouTube, it's on TikTok. No one trusts those sources, even though they consume a lot of it. The one that people trust more than they distrust is still their local news, local newspapers. So getting stories in those outlets still holds a lot of weight. And you know who else reads those? Members of Congress themselves. So that's why I say, don't think that, you need to land an op-ed in the New York Times. You don't. Your local newspaper is the most credible source for other people just like you who need to know that these cuts have already taken place. They're the fault of Republicans, and they're looking to do even more this spring.
That is so important. And can people get involved with Protect Our Care? How can people get involved with what you're doing?
Absolutely. Of course, we got, protectourcare.org, but I would also say April is Medicaid Awareness Month, and there's never been a more important Medicaid Awareness Month, I would argue. You can go to MedicaidAwareness.com, and there you'll see a lot of resources, not just messaging and talking points, but also stories of those who are impacted, who you might not realize. And, I know people think about storytellers and especially healthcare storytellers, and they think and we've probably all heard these really impactful, compelling stories that really tug at your heartstrings, and those matter a lot. They make a difference. But so do the mundane, so do the ordinary stories, because those are the ones that people connect with. They realize, oh my gosh, this person who, had to work two jobs to afford healthcare, or a person who had one job and all of a sudden their premiums went up by 200%, all for no reason except that billionaires need another tax cut. Those resonate with people because then they realize how many people are affected by these nonsensical cuts. So, like I said, don't think that your story is not somehow compelling enough to share. It is, I promise you, and it's more of a numbers game. So share your story, encourage others to share their story, and before you know it, we're going to be a force that's tough to ignore.
And we definitely are a force that's tough to ignore. I was really excited. I don't know about you, but after we had massive numbers of people reaching out to the House of Representatives, we got 3 Republican people to vote with all of the Democrats to extend the Affordable Care Act tax credits. That was great. Then we kept pushing and pushing and pushing. We got 17 Republicans to join every single Democrat in supporting the extension of the Affordable Care Act tax extensions. And you know what? It passed the U.S. House. Now it's stuck in the U.S. Senate right now. The U.S. Senate is doing lots of other distractions, disasters, all kinds of things are happening. But the important thing is that when we push, we do win. And so now we need to keep pushing on the Senate to extend the Affordable Care Act tax credits. And then we also need to push on every single person to say, hey, stop cutting healthcare. In fact, reverse the cuts. And I want to talk about that for a minute, about expectations. So when you were talking about this long, ridiculous list of people that Republican leaders and Donald Trump are saying, should be pushed off of specific programs, right? Okay, that's ridiculous. In most countries in the whole planet Earth, you get access to healthcare no matter where you live or work or what you do, right? Like, we shouldn't be arguing like, oh, this person should and this person shouldn't have access to healthcare. I get so annoyed that we're having to argue about these specifics related to specific programs. In my heart of heart, and I bet in yours too, we just need healthcare access for everybody. Everybody gets sick. I don't know a single person who has never needed, some type of doctor experience at some point in their life, and everybody needs a chance to get better. So what's your take on the next leap forward? Say that we save all of these important programs. Do you think that we together deserve a unified healthcare program where if anybody gets sick, they get a chance to get better? So we don't have to keep arguing about these ridiculous specifics that are made up distractions.
Kristen, the answer to your question is not yes. It is hell yes. Healthcare is a human right. Everyone, there is no who deserves it and who doesn't. We all are entitled to healthcare. You believe that, I believe that. It's a truth. Anyone who has worked in healthcare advocacy or especially direct care knows this to be true. And I'm sorry that we can't have that debate right now because of who's in charge. But I will say this, when Barack Obama passed the Affordable Care Act, and I know, same thing then, right? Like, it wasn't what everyone on the left wanted. It certainly wasn't what people on the right wanted, myself included. Like, while a lot of us hoped it would do more, but we had to take what we could get at the time. And President Obama at the time described it as a starter home, right? Think of it as like, it's not ideal, but over time you add to it. You make it better, you make it bigger. And that's exactly what happened through his administration and through Joe Biden's administration. And so the idea was that one day, yes, we would obtain universal coverage. It should not be that difficult in any country, let alone the most prosperous country on earth. But this is where we find ourselves. And especially now, when Republicans are hell-bent on taking it apart piece by piece, and those pieces are getting bigger. So here's what I'd say. If we can maintain the ACA, we kept it from being repealed once, we got to maintain the ACA as it stands so that we can continue to build on it in future administrations. We have to keep as much Medicaid intact as possible because that also plays with the ACA, right? The ACA expanded Medicaid to people who are up to 133% of the poverty level. So that's another place that Republicans have taken target, even though, as I've said before, those people work. They're not unemployed. They're not in their mother's basement playing video games. They work. We're just putting unnecessarily cumbersome requirements in the form of paperwork on them. I would say if we can weather this storm and if we can win more elections this year in the cycle left, and I know the blue team is tired of hearing that. I'm tired of saying it, but unfortunately, it's the necessary evil where we are right now. If we can win elections, and by the way, the most salient political issue right now is healthcare. If you ask voters, especially independent voters, what do you care about the most right now? It's not all the distractions. It's healthcare. It's healthcare costs. It's costs generally. This is how we can win. This is how good guys can win in November again this year. And when we start taking back seats, and eventually when we take back the White House, then we can continue building on what was once that starter home in the ACA, and we can get toward our shared dream of having universal coverage in this country.
I agree with you 1000%. I'm so thankful for your leadership, for all you do. Thank you for being on with us today. Thank you for keeping the fight moving forward for healthcare. Thank you.
You're the absolute best, Kristen. It's wonderful to be with you.
Thank you. You too. We're going to take a quick break, but stick around. We'll be right back with our next guest from Justice and Aging. Yes, we're talking healthcare and aging and youth. We'll be back in a quick moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a spectacular, spectacular, spectacular guest with us today, Natalie Kean with Justice in Aging. Welcome, Natalie.
Thank you so much, Kristen. I'm really excited to be here and to talk about Medicaid. It's one of my love languages. So
I love Medicaid too. A lot of people don't realize how much Medicaid is woven through our entire patchwork healthcare non-system in America. And I say that because there's a lot of parts of the healthcare system. There's the ACA, there's Medicare, there's Medicaid, there's SCHIP, there's more. And so I'm wondering, to start out, can you talk a little bit about how Medicaid is situated in the web of healthcare programs in America?
yeah, so Medicaid is one of the core programs. It was enacted at the same time as Medicare. So it has a long and rich history and plays a very, very important role for older adults. Medicaid's really an anti-poverty program, and that's what it was created for, to help us fight poverty. And it's really core to our mission at Justice in Aging. That is our mission, to fight senior poverty. And it's really important for older adults and older women in particular. I don't think most people realize until they're older themselves or helping care for an aging parent or other older adult in their life, how much heavy lifting Medicaid does.
Medicaid is under attack over and over again by Republican leaders and Donald Trump. It's unbelievable how much Medicaid is under attack. I mean, I cannot even believe it, because it's a program that actually boosts our economy. It boosts families. It helps our elders. It lifts our families. There is so much data about how Medicaid really, 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 really helps America. And so can you share a little bit more about why Medicaid is specifically important for older adults?
Yeah, so Medicaid is filling in the gaps in Medicare. So people are much more familiar with Medicare. That's the program for people age 65 and older and people with disabilities. But Medicare is not free. It has monthly premiums and cost sharing, and it's Medicaid that steps in to help over 12 million older adults and people with disabilities afford to access their healthcare coverage. And Medicare also doesn't cover things like routine dental care, vision, or hearing services. And Medicaid is helping many older adults access those basic healthcare services. And then the biggest gap, which I know you know, Kristen, is where Medicaid is just so indispensable in terms of long-term care. It's the primary payer for both care at home as people age and for people with disabilities, and then also for care in nursing facilities.
It's huge, you all. It's huge. It's so important. Medicaid is so important. It's like the unsung hero of healthcare. And again, the unsung hero has been eviscerated by Donald Trump and Republican leaders. And I think evisceration is the right word. Can you share a little bit with our listeners, with our audience, about what the heck just happened to Medicaid in the Budget Reconciliation Act of 2025? I mean, it's really bad. What's been cut?
Yeah, so $1 trillion has been cut from federal spending on Medicaid.
With a T?
Yes.
Like Triceratops?
Exactly.
Yes.
Yeah. I mean, it is by and far and away the largest cut ever to this program. And so we're just beginning to feel the effects of it. These cuts are going to reverberate for decades and decades. But what we're seeing is that this gutting of federal funding is, pushing costs to states. States have to balance their budget. They share a portion of Medicaid costs with the federal government. And what they're doing is proposing to cut the Medicaid programs that support older adults and people with disabilities to live in the community. That's the first thing to be cut. We warned Congress and everyone who would listen, or even if they wouldn't listen, we warned and warned that this would be the result of cutting Medicaid at the level that Congress has, and sadly, it's happening. And some in the Trump administration and leaders in Congress, they aren't done. They want to keep cutting Medicaid.
I mean, I can't even believe it. My jaw dropped when I saw the proposed budgets for 2026 and beyond, cutting Medicaid even more. The thing that's important to notice is that if we're lucky, we all age and get older.
Yes.
And we need everybody to be able to age with dignity. And what we just heard Natalie say is something really important, and that's that the home and community-based services part of Medicaid took a really big hit. Research shows that if you can get access as you're aging, hopefully with the ability to have home and community-based services, that actually helps save costs, lower costs, because you avoid costly longer-term facilities, costly longer-term hospital stays. It actually helps also increase the dignity and the happy lived experience of people as they're aging. And also, there are healthcare workers. Home healthcare workers are an incredible field of people who also need to be treated with dignity and paid living wages. All of this just took a big hit. And when we're talking about a big hit, one of the things that Natalie mentioned that I just want to underscore is we haven't seen the full impact of the Medicaid cost cuts that happened from Donald Trump and Republican leaders yet, because they actually staged the cuts over time. So we're in a period of time where there will be increased cuts, many of which happen after the midterm elections. And so we won't see the full negative impact yet. So if you think your healthcare costs are high now for you, yourself, or a loved one, they're about to get a whole lot worse. We need Congress to reverse the cuts. And here's the thing. There's hope, because we can actually reverse the cuts. We're going to potentially need a different leadership in order to reverse the cuts, or, maybe fully need different leadership to reverse the cuts. So I'll say that, but it is possible to reverse the cuts. Can you talk a little bit more about the effects cuts to home and community-based services, which some people call HCBS, including me, that are happening through the cuts to Medicaid, and why that's so important to protect?
Yeah, so I mean, you hit the nail on the head that this is a privilege to age in this country, and unfortunately, it shouldn't be a privilege to age with dignity. But Medicaid is so critical, and really the only program that helps older adults grow old and be able to stay at home and connected to their families. We know this is what the vast majority of people want to do. And with support of Medicaid, they can do that. But if they don't get that support, people who don't need or want to be in a nursing facility end up there, because that's the only option for them. So some of the cuts we're seeing, whether it's states are proposing to end programs completely, or cut the number of hours that someone can have personal care aide come and help them every day, or cutting the reimbursement rate for providers. That just translates into either stagnant or lower wages for the direct care workforce, which is already in a crisis because they are underpaid and undervalued. So the result, whatever the shape of the cut is the same. It shifts costs to families. People have to go into institutions, which cost everyone, including the state and federal government, more money. And sadly, it can be a matter of life and death for older adults and people with disabilities, whether they get these home and community-based services.
It is so important. And I know you just mentioned people with disabilities as well. I'm wondering if you could share a little bit more about how people with disabilities are being disproportionately negatively impacted by the Medicaid cuts that Republican leaders in Congress and Donald Trump have been pushing forward and continue to push forward. Just absolutely ridiculous.
Yeah. So the cuts that are, continuing to be called for are more directly coming at aging and disability supports in Medicaid. Over 70% of of optional spending that states have under Medicaid. So this is the services that they can choose to provide or not. Over 70% of that supports older adults and people with disabilities. So now, we're seeing it at the state level that states are cutting back on those services. And then we're seeing further calls at the federal level directly targeting those services as, wasteful or unnecessary spending. And it's couldn't be further from the truth.
Could not be further from the truth. The picture that is painted of the people who need access to Medicaid is very different than the people who need to utilize and actually are utilizing Medicaid. And I'm wondering if you could share a little bit about that. I know I'm putting you on the spot right now, but it makes me so mad when I read, like Republican leaders in Congress description of who's being cut, and then I know who's actually being cut. And that comment that you just made brought that up for me. So I wonder if you want to share.
Yeah, absolutely. I mean, again, I said this earlier, we warned that this would be the result. There's no way to cut Medicaid funding without harming older adults and people with disabilities, because the program is just so critical for them, and especially for these home and community-based services. And so that those are the primary people who are being hurt by the cuts. And then, looking at just who is enrolled in Medicaid, it's a lot of caregivers as well, and a lot of women are enrolled in Medicaid because they have taken time out from the paid workforce to provide care for their families. So, it's going to hit older adults and people with disabilities in multiple ways, whether it's their caregiver losing coverage or having to go back to work, or direct cuts that we're seeing to these programs.
What can people do? I hope people who are listening and watching are just like outraged like I am and want to take action. How can people take action, and how can they take action also with justice and aging?
Yes. So I think telling your care story is always the most important thing. I guarantee an older adult in your life has depended on Medicaid. So what would it mean if that support went away? I think sharing that to your lawmakers, but also your neighbors, writing letters to the editor in your local paper is super helpful. And then we are really encouraging people to get involved at the state and local level, talking about the need to invest in these services. So states are cutting home and community-based services because federal law allows them to, and they're under budget pressure, but that's not the only option. States could also be raising revenues. And it's really important for people to weigh in and say, we need this, we need investments in our care.
Thank you so much. Last question. How can people get involved with justice and aging? Where's your URL? Where are you on socials? What's happening?
Yeah, so we are at justiceinaging.org, and we have a ton of resources and materials, a lot of webinars and things that go into detail on all these programs, and it's all free. So we welcome you to join and sign up for our listserv there. And then also find us on Blue Sky, on LinkedIn, on Twitter. I'm Kean, Natalie on Twitter.
Thank you so much for being on, Natalie Kean with Justice and Aging. Thank you.
Thank you.
We're going to take a quick break, but don't go away. We're going to hear an important healthcare story about how access to healthcare saves lives, and also about active peace, self-care, and more in a moment. We'll be back in just a little bit. We are joined by an amazing rock star, superstar person, Reggie Hubbard, who is the founder and chief serving officer at, I got to redo it, Active Peace. Hold on. All right, I'm putting it over here. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined by a superstar leader, a superstar organizer, a superstar lifter, Reggie Hubbard, who is the Chief Serving Officer and founder of Active Peace. Welcome, Reggie.
Good to see you as always. Peace be with you.
You too. I want to talk with you about healthcare and peace. Healthcare and peace. We're doing a healthcare takeover of the radio show this week. We're doing all healthcare all the time because healthcare is under threat. We've got Donald Trump and Republican leaders in Congress just absolutely cutting healthcare, cutting Medicaid by over $100 million, and then suggesting that we cut it again. Why is access to healthcare and knowing that you have access to healthcare part of Active Peace?
So you may know this, but we definitely haven't talked about it. 2 years ago on April 1st, I had a stroke and almost left us, honestly. And the access to care, the quality and continuity of care, not just at the inception of the stroke, but once you have the stroke and then there's everything that happens afterwards, right? So I was able to be admitted to the hospital. My stroke happened in South Carolina, and I live in Maryland and Virginia and Washington, D.C. So the DMV is where my insurance network is. Because of the Affordable Care Act, Blue Cross Blue Shield South Carolina and Blue Cross Blue Shield Maryland talk. So my $65,000 stroke, I paid $2,400 out of pocket for it. So healthcare is important, one, because like I survived the stroke, but in the back of my mind, I was like, how am I going to pay for this shit? Right. And so like, cause I'm a contractor, I have my own business, right? Like, so, I mean, I still have a lot of influence in certain circles, but I run my own shingle. And so to know that I could go to the hospital during the stroke, then afterwards I had access to quality care for acute recovery, and then the duration of recovery afterwards gave me such peace of mind that I could focus on my recovery as opposed of you know what I mean? So instead of being lost in the sauce of like, how am I going to pay for this? Having healthcare and affordable healthcare, because I live in Maryland, so shout out to the Maryland Exchange. On the Democratic Party in Maryland, I didn't have all of the worries that a lot of people have now of can I afford it? Like, can I even go to the doctor? If I do go to the doctor, can I afford it? And if something happens to me, if the unthinkable happens to me, what will I do? All of those things I didn't really have to worry about.
It's so important. And I just want to say, I'm so glad you're still here, Reggie. I'm so glad that you got access to healthcare. I'm so glad you got access to, healthcare after you had the critical moment to continue recovery over time. I'm just so thankful.
Same.
When we're talking about healthcare, you mentioned the Affordable Care Act and the exchanges. And what a lot of people don't realize is that the American healthcare system is not so much a system as a patchwork. We've got Medicaid, we've got Medicare, we've got the Affordable Care Act, which is also known as the ACA, which is also known as the exchanges. And in fact, those are titled something different in every state. The Affordable Care Act has a different name in every state. In Washington State, it's Apple Care. I've heard all kinds of different names for the Affordable Care Act. Similarly, Medicaid and Medicare often have different names in different states. So people don't often realize how tied together our patchwork healthcare system is with what happens in Washington, D.C. Because a lot of the funds from those programs, in fact, most of them do come from Washington, D.C. to the states where they have localized state program titles, but not as much localized state funding. So in this context, we have the Affordable Care Act, which was passed over a decade ago and brought access to affordable healthcare to tens of millions of people, like 40 million people. And then it also did these incredible consumer protections, like you couldn't be denied healthcare due to a pre-existing condition, which could be just about anything before they passed the Affordable Care Act. In some instance, it was like if your gender was a woman because they were worried you were going to have a baby, that was a pre-existing condition. Like, what the heck? It could be if you have asthma, which 1 in 10 people, including me, have, then it could be a pre-existing condition. If you've had a stroke, that could be a pre-existing condition. They could just make it up. And then the
Yeah.
other thing that it had before the Affordable Care Act was lifetime limits on coverage, which
Yep.
made a lifetime limit on actually living for many people with a chronic condition,
Totally.
which is horrible. And so the Republican leadership and Donald Trump have tried to overturn the Affordable Care Act more than 50 times. We have risen up together, Moms Rising organizations, we've worked with you, and we've
Yeah.
saved the Affordable Care Act more than 50 times. Two
Totally.
times, everybody thought we were going to lose because there was a Republican leadership in the House, the Senate, and the Oval Office who all thought they could take it out, but we won against all odds. Now we're in another situation.
Yep.
It's like a level 22 situation when there's only 10 levels. And that is that Republican leadership and Donald Trump want to eviscerate the Affordable Care Act by just not extending the payment
Tax credits.
opportunities through the tax credits
Yep.
that are coming to families. And people are like, oh, tax credits, that may not be a lot. Well, it's going to cause a 70% increase in costs, 90% in many rural areas in Affordable Care Act.
In many
aided
cases, it
healthcare.
already has. In many cases, it already has. Yeah.
Yeah. So we're in this situation where healthcare is under threat by Republican leaders. Now, Democrats need healthcare. Republicans need healthcare too. Everybody gets sick. Everybody needs to get better. What's your take on why healthcare, the Affordable Care Act, Medicaid and Medicare, is under continuous threat from Donald Trump and Republican leaders? Why is this happening?
Well, I mean, I think the short answer is cruelty. Right? If you are not of value to someone's worldview, then you are disposable. And if you are someone with a chronic condition, you're disposable. You can't work hard. You know what I mean? So in a capitalist system, in a capitalist mindset, and the billionaire class, not all of them. I know some good people with wealth, but I don't know many of them. So if you aren't of value to how someone with power's worldview is, then you're disposable. One. Two is that sick people don't usually complain. They're too busy trying to stay alive, right? So, like, if they were to try and attack the, say, bloated military budget, people would be like, but wait, it's national defense. But if I'm worried about just staying alive or getting to the doctor and all these other things, like, I don't have time to necessarily complain or pay attention. What they didn't anticipate necessarily is that the same grassroots fervor that we met them the last time they tried this stuff in the late teens would be met. So what they also did, as you know, is that they buried all the terrible stuff that's happening with the cuts till after the midterm election. So they think that they're going to get away with that. So it's looking increasingly like, and we don't take any of this for granted, it's looking increasingly like there'll be a electoral reckoning with a Democratic majority, at least in the House. So when the bad stuff hits, they're going to blame it on Democrats, even though they wrote the bill that way. So it's up to us to continue to tell folks that they did this to you. They didn't think you were paying attention. So not only pay attention, but remind them that we're the boss. We, the people, are the boss. Like, we have been conditioned to think, oh, what will we do? They're only in office because, and you know this, the person who won the electoral vote in 2024 wasn't Kamala Harris. It wasn't Donald Trump. It was undecided or did not participate. So
that is so important. Undecided or did not participate won the 2024 election, which means you all have a job to do. A, you should participate. Please, please, please. Democracy is not a spectator sport. When we take the hands off the wheels of our democracy and think it's going to be a self-driving car, does not work. There is no Waymo democracy, people. That is not a thing. We need everybody to make sure that you're registered to vote and to check that your voter registration is accurate once a month until the November elections. Hello, there's a lot of strange things happening right now with voter suppression legislation being put forward by Republican leaders and Donald Trump. So make sure you're registered to vote now and double check every month. And how many friends should people also check in on their voter registration? I want to say 500, but we got to make this doable. Like, what do you think we should be asking people to do? Because we need some local community organizing.
3 to 5, but do it per month.
Ooh.
Right. So 3 to 5 total. Come on, that's too easy.
Yeah.
3 to 5 per month, and it can't be the same 3 to 5 necessarily. You know what I mean? So if you only got 3 to 5 friends, cool. But if you got more than 3 to 5, just check on them because remind in the same way that when I had my stroke, like it totally supercharged my activism because I was telling everybody that go to the if you can go to the doctor. You've been to the doctor. Our democracy is having an acute moment right now. So the medicine for our electoral problems is voting and civic engagement. So if we're talking about healthcare, the health of our democracy is at risk. So the way that we extend healthcare to democracy is by increasing civic participation. So in the same way that we fought for the Affordable Care Act, or we fought against the big, ugly, terrible, disgusting bill, we need to fight for civic engagement, because if voting wasn't so important, why are they trying to take it away? If healthcare wasn't so important, why are they trying to eviscerate it? You know, that's kind of a second answer to your question. One, sick people don't complain, and two is that less people alive basically makes it easier for them to vote, easier for them to win.
One of the things that we only have 2.5 minutes left, but we're talking about the health of democracy. We're talking about stress because these headlines are stressful. Let me tell you, what have you learned at Active Peace that everyone should know about how to do self-care?
So I started this when I was at Move On, right? You know, I took yoga and meditation teacher training while impeaching presidents and leading marches and all these other things. And the two things I would say are this. One, it is easier to take care of your mental health than you think, right? You know, most people think meditation is, oh, I need to sit in the floor in this uncomfortable thing and get my mind to stop thinking. No. Meditation is focusing on something other than your thoughts. So it could be listening to the birds. It could be playing with your children. It could be focusing when you take a walk, one foot in front of the other, instead of being distracted, right? So the first thing is it's easier to take care of your mental well-being than you think. The second thing is that we're in a state of psychological warfare, y'all, right? So we are being attacked through our lack of attention span. So having mental clarity and physical well-being when they're cutting healthcare and attacking your conscious mind, that's the superpower. Right? So to run around sick and stressed out is to play into the game that they're falling for. You know, that's the trap they've laid for you. So what I've learned over the course of combining my activist practice with my teaching practice is that being of sound mind and sound body is the superpower to Project 2025 and all these other crazy Republican conservative ideals, especially as a black dude. You kidding me? Right. So focusing on my health mentally and physically in this skin when it's almost illegal to be black is the superpower. And whether you're black or female or queer or whatever you are, however you identify, you taking care of you is the best way to take care of us.
I love that so much. How can people follow Active Peace, get involved, all of that?
So at Active Peace Yoga on the socials, at Reggie Global. So I'm still a person. So the teaching practice is its own thing, but Reggie Global is on Blue Sky and Instagram and all of these things. And activepeaceyoga.com. I mean, one of the things that I do a lot of, as you see, is instruments. So I have a lot of instruments that basically pure sound allows for a clear mind. A clear mind makes you make better decisions.
Thank you so much for being on. Reggie, Hubbard, thank you for all that you do. Thank you for sharing your story. So glad you got healthcare and you're still here. Thank you.
Absolutely. Always a pleasure.
We're going to take a quick break, but don't go away. Next up, we hear about how your voice, your story, your actions are needed now more than ever to help protect healthcare and what you can do. We'll be back in just a moment. And we're doing a health care takeover show this week. Thank you so much for tuning in. We have Donna Norton, who is a healthcare champion, a healthcare superhero, a person who has helped advance healthcare more than almost any other person on the United States of America country map. Welcome, Donna.
Thank you.
So we've been talking about how healthcare is under such deep threat right now. And what a lot of people don't realize is why. why is Donald Trump and Republican leaders in Congress looking at the national budget and saying, oh, let's get rid of healthcare, even though, as far as I can tell, Republicans get earaches and ear infections and Democrats do too. I mean, we all get sick. So what the heck?
Well, that seems not to be their priority to invest in our healthcare. In fact, last Friday, Donald Trump submitted his annual budget request to Congress, and it called for just a massive increase in spending for the military, like historic increase that we haven't seen in 50 years, and cuts to the Department of Health and Human Services. And so on top of the $1 trillion they cut from Medicaid last year, they're calling for more cuts in order to fund this massive increase both in military spending and in the money that they're spending for mass detention of immigrants.
I mean, it's ridiculous. They're moving money out of healthcare to fund Trump's personal wars. They have not been actually passed by Congress, as our U.S. Constitution says that needs to happen. So they're personal wars, and we're funding that with our healthcare money, and to fund his personal attack on immigrant families, which has proven over and over again to be just a basic, absolute increase on human rights abuses. And we need safe and secure borders. But we don't need cuts to healthcare. We don't need cuts to childcare. We don't need cruelty. And in the mix, we have people who are suddenly realizing that, oh my gosh, either I'm losing my healthcare or my healthcare costs are going up astronomically. What are you hearing from Moms Rising members?
I mean, we're hearing from members all over the country who are talking about, how they're seeing cuts to home community-based services that are so important for helping moms care for elderly relatives or kids with disabilities. We're seeing, lots of people talking about how their rates of insurance are going up, how their coverage of insurance is getting worse. Lots of concern about care for elderly people in Medicaid facilities. We're hearing about health hospitals and elder care facilities closing because lack of funding. There's about 750 to 800 hospitals, clinics, and nursing homes that are either at risk of being closed or already closed because of the cuts. So there's a huge amount of concern out there.
Yeah, so I'm hearing the concern too. People are like, wait a minute, what happened to my monthly bill? And as we've been hearing, the monthly bills are going to just go up even more because these cuts are staged over time. Like, they're not going to happen on one day. They're staged to have increased cuts and come in play at different points on the calendar after the midterms. So we haven't even seen the worst of it yet. What can people do, Donna?
Well, absolutely, people can raise their voices and call their members of Congress. The thing about this bill is they need a majority of both the House and the Senate to pass it. And there's such a razor thin majority of Republicans in the House. And we're starting to hear from a lot of Republicans who are part of the kind of MAGA constituency that they don't even support these huge, giant increases for military expenditures. And so I think there's a ton of room there for people to really raise their voices and talk about how important this is to constituents, and to talk about how gas prices are rising. People are really we're all struggling to make ends meet in this environment where prices are rising because of gas prices, because of what's happening in Iran and in the Middle East, but also because of Trump's tariffs and cuts to healthcare, cuts to childcare. All these costs are really huge, just pressures on all our families. And so to talk to your members of Congress and to tell them this is not making our lives more affordable. We need you to prioritize our families, our healthcare, our childcare. This is a really great time to do it, and I think we should be able to defeat these cuts to our healthcare.
I agree. We should be able to defeat. We've won against all odds in the past. And I'm wondering, Donna, if you could tell us a little bit more about what we are calling to say to defeat. In fact, I'll give listeners a clue. It's more cuts to healthcare on top of what has already happened. But can you share a little bit about when we pick up the phone and call our member of Congress and say vote no? What are we telling them to vote no on right now?
Well, I mean, first of all, we should emphasize that these are our tax dollars. So we want our tax dollars to be spent to support our families, to support our health care, to support our child care, our elder care. And we don't want our tax dollars spent on funding more reckless wars, more human rights abuses against immigrant friends and families and neighbors who are critical to both our economies, our care infrastructure, and our futures. So just like that basic message, you don't need to get into the details. People just need to hear that these are our family's priorities, and we know these are our tax dollars, and they're accountable to us.
They are accountable to us at the ballot box, you all. And here's something that's really interesting. Republicans, Democrats, independents, everybody across the country actually supports access to healthcare coverage and supports expanding access to healthcare coverage, not shrinking it. And so right now we have a situation where those Republican leaders in Congress and those Republican leader who is in the White House right now are completely out of step with their own Republican constituents. That means that the math for them is not mathing. The math for us is mathing. And that means that absolutely what Donna said is true. We can win. We can stop these cuts that are expected to be proposed in the legislation that's coming up right now. Like we need to roll back the cuts that already happened. And we need to stop the cuts that are currently proposed. Yes, we can do two things at the same time. We can walk and chew gum. Yes, that has happened. I have done it myself. I've walked and chewed gum. So we need to tell our members of Congress, reverse the past healthcare cuts and actually stop the current cuts. It's like a double thing. What do you think about that, Donna?
Yeah, absolutely. And even if your member of Congress is on your side, it just helps them so much to be able to talk to their colleagues and say, you know, my phone is being like completely overloaded with pissed off constituents. And I'm hearing these stories and sharing your stories, and they remember the stories and they bring those stories to their speeches on the floor and when they talk to other members of Congress. So regardless of who your member of Congress is, it's really important to speak up.
150%. So how can they do that with Moms Rising?
Well, with Moms Rising, you can go to our website and sign up to be a member. It's free, and we'll just be sending you different ways that you can activate, whether it's signing a petition or sharing a story or writing a letter to the editor or making a phone call. We make it super easy, and we welcome anybody who has a belly button, moms, but everybody else. So hopefully you all will join us.
And Donna, we are in a moment where the majority of other industrialized nations actually have universal health care. They're not over here debating about what parts and pieces of healthcare are going to be cut and what parts are going to be saved. They just have universal health care. And it is frustrating, I know, to be out here kind of saying, okay, we need to save this part of the patchwork quilt that is healthcare in America, instead of saying, hello, give us an entirely new quilt that actually fits together for everyone. What's giving you hope in this incredibly frustrating moment where we're having to say the obvious? Hello, everyone needs healthcare. What's giving you hope?
Well, I think, you know, to think back on when we were fighting back to pass Obamacare, and there was a lot of concern about universal health care, that people wanted to keep their, you know, insurance. And I think as time has gone on, people have really realized that people really want to get to Medicare. Like, people are, whether they have private health insurance or not, are relieved when they get on Medicare, because they kind of know that they're in the safe zone and they can't be subject to these strange, you know, fees that come out of nowhere, and that, everybody would like to have that level of safety and coverage. And I think we're getting to a place where we can get to that level of coverage for all Americans. So it's been a painful process, and we've made a lot of progress along the way. But I think people are realizing that what other countries have is way more efficient for our societies, and even better quality than what we have. And the amount of healthcare that is driven by profit and profit motives is very concerning in the US. And I think all of us, at least when I am told like I need a surgery or something by a doctor, I am always like, well, okay, well, that could be true, but there could be a profit motive going on here. And I think none of us needs to have to be like, medical detectives to try to figure out what's best for our health. And so I think we are getting closer to that consensus.
Yeah, but we need a change, you all. Consensus is, hello, we need a healthcare system that covers everybody all the time, no matter where you work or live. Healthcare is a human right. And yes, as we go toward that goal, we also need to roll back the cuts that have been made to Medicaid, to Medicare, to the Affordable Care Act, to all of the healthcare programs that have been under attack. Those healthcare programs need to be restored, and then we need to make a giant leap forward. So, or we could, restore them and make a giant leap forward at the same time. I'm okay with either option.
Yes,
but
progress in any way forward.
Yeah.
Agree.
And for so many people, healthcare is an emergency. When you need healthcare, that's the moment where you probably don't have a lot of time to lobby Congress and say like, oh, what happened to my healthcare? So it's true that your stories are very, 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 very important. Members of Congress actually have healthcare through their job in Congress. They do not have to worry about their own healthcare. So many of them have no clue how worrisome it is to have healthcare coverage or not be on your mind all the time. So call your member of Congress, and your story doesn't have to be like, 5 hours long. It's hard for me to do a story that is less than 5 hours long. I will admit it, but it can be something really short. Like, I got sick. I had access to healthcare, so I got antibiotics for strep throat, and I didn't end up with scarlet fever, which would cost a whole lot more. I mean, it could be that short. Or it could be I got sick, I got strep throat, I ended up with scarlet fever because I didn't have access to healthcare, and it ended up costing everybody, including me, a whole lot more. Like, it could be either way. So I think, there's a lot that we can do. Any closing thoughts in 30 seconds?
Well, just on your stories, we are finding that because people are so skeptical about the news right now and are turning off to like regular sources of news, that the things that are most convincing both for the public and for members of Congress are those personal stories. You can't argue with the truth of somebody really telling their own personal story and their own emotional way. That's something that nobody can argue against. And so those stories are like gold. So thank you all for all of you who are sharing those.
Thank you so much, Donna Norton, for sharing your story, for sharing your advocacy, for sharing your leadership. And everybody go to momsrising.org and figure out how you can share your story too, because we're collecting stories all the time. Thank you so much, Donna Norton, for your leadership.
Thank you.
Well, that's it for our show today. Thanks so much for tuning in as we tackle the top topics facing our nation in a way that requires the most boring disclaimer in the history of the planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to Moms Rising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom!